Hi, today we will be talking about healing of the wounds and burns. Wounds. A wound is an injury that causes either an internal or external break in the body issue. A closed wound is a bruise that damages the underlying tissue without breaking the skin, like, for example, a black eye. An open wound, as in a knife cut, is a break in the skin or mucous membrane. This is a picture of the layers of the skin, which contains the epidermis, dermis, and hypodermis. There are four burns classification depth. The first degree only in the epidermis. Second degree is the epidermis and dermis, excluding all the dermal appendages. Third degree is the epidermis and all of the dermis. Fourth degree, epidermis, dermis, and subcutaneous tissue. For example, fat, muscles, bones, and peripheral nerves. This is a picture of the rules of nines. This is a picture of the types of burns. The effects of burns. Burn injury causes destructions of tissue, usually the skin, from exposure to thermal extremes, either hot or cold, electricity, chemicals, or radiation. The mucosa of the upper GI system can be burned with ingestions of chemicals. Skin damage can result in altered ability to sense pain, touch, and temperature. Statistics of burn injuries. Annually, there are 1.25 million people in the U.S. who sustain burn injuries. Of these, 5,500 do not survive, and 51,000 requires hospitalization. Person who burns injury requires hospitalizations have about a 50% chance of sustaining temporary or permanent disability. The most common part of the body involved in burn injury is an upper extremity, followed by the hands and neck. Phases of healing. First stage is inflammatory, is the reactive stage, has bleeding, clotting, migration of the white blood cells, cell swelling. Second is the proliferative, is the reparative layers, laying down of collagens plus migration of the epithelial cells, new capillary loops, proliferations of fibroblasts going to the strands of collagens. Last is maturations, remodeling, reorientations of contractions of collagens, synthesis degradations, lower vascularity. Wound healing. As wound heals, fluid and cells drains from damaged tissue. Exudates may be clean, body, or pus containing. Proper wound healing has cleanliness and care of lesions, proper circulations, good gender health and nutrition. Burn treatment. Respiratory care, administer of fluids, pain control, plastic surgery, monitoring for complications like infections, cardiovascular, respiratory, massage and physical therapy, post-traumatic stress.